Good to go.
Assalamu alaikum. Welcome. Good evening to you all. Thank you for joining us. My name is Omar. I am chair of the South East London and Kent Council of Mosques and your co-host for tonight. Gives me great pleasure to be able to help organize this panel discussion today on a very relevant topic, a topic that I'm sure is on the minds of all. We've got a wonderful line of panelists tonight. Just to briefly introduce you to them. So Professor Ijaz, my colleague, will be co-hosting and will run through the session. We have Imam Shakil Beg, we have Dr. Wajid Akhtar, we have Marjan Jamal, we have Dr. Javeed Ahmed, and we're hoping that we'll be able to offer explanations, answer questions, expel any concerns that you may have about the COVID-19 vaccinations. At the same time, this session is for you. It's for the community. We want you to be able to feel comfortable in asking whatever questions that you may have. Please feel free to challenge the panelists as well. No question is too challenging, and we really want you to feel comfortable in doing so. So please do feel free to pop your questions in the Q&A, or if you're on YouTube as well, in the chat, and we will do our best to answer them. In terms of the general itinerary, so each of the panelists will give a short presentation on a certain topic, which Professor Ijaz will introduce. We aim to be done with the presentations within around 45 minutes. Thereafter, the second half of this evening, we'll be looking at an open Q&A. So we hope to be able to go through your questions, answer them to the best of our abilities, and hopefully by the end, be slightly wiser on the COVID-19 vaccinations. And so without further ado, allow me to hand over to Professor Ijaz.
Assalamu alaikum everyone, and welcome to the panel session on COVID and vaccinations. We've got a really excellent panel of speakers today. And what I would like to do is first of all ask the viewers to switch off their microphones while the talks are going on. There will be an opportunity for question and answers after the talks, so have some ready. And what we aim to do is have the talks for about 40 to 45 minutes, and after that, the question and answer session. So that will be plenty of time, finishing by about 9:30. So our first speaker today is Imam Shakil Beg, who is the Imam at Lewisham Islamic Centre, and he also represents SELKCOM. His talk today is on the Islamic guidance on COVID-19 vaccination. Imam sir.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala ashraf al-anbiya al-mursaleen nabina Muhammad wa ala alihi wa sahbihi ajma'een amma ba'd. All praise belongs to Allah Tabaraka wa Ta'ala, and peace and blessings of Allah Ta'ala be upon all the prophets of Allah and the last and final messenger of Allah, the Imam of the messengers, the best of the messengers, our beloved, Allah's beloved Muhammad sallallahu alayhi wa ala alihi wa sallam. Brothers, sisters and viewers, assalamu alaikum wa rahmatullahi wa barakatuh. Special thanks to Dr. Omar Taha and Professor Ijaz for organizing this discussion and this event. It's a very pertinent discussion, a very important discussion because of what we are facing today, the challenges that we are facing concerning this COVID pandemic that the world is facing. So I want to be very, very brief in reality, because I do feel specialists that we have on board today, Dr. Javed, Dr. Wajid, Ustada, Marjan and others, let them be the ones, inshallah, that will speak on this topic rather than myself. So my point will be very, very brief, brothers and sisters. And I want to reflect on a few Islamic perspectives concerning what we're facing today. And number one, I want to focus on death as a reminder for ourselves. Allah Ta'ala tells us, Kullu nafsin dha'ikatul maut. Every soul shall taste death. Remember, just yesterday, I'm not sure of the numbers today, but yesterday was 1,564 deaths because of this virus. That's a major, major figure for ourselves. And whenever, I'm giving a reminder about death, I focus on myself. When will it be my return to turn to my creator? And that's our beloved Messenger sallallahu alaihi wasallam in a hadith. He said, "Akthiru min dhikri hadim al-ladhat." Increase in the remembrance of the destroyer of all pleasures, i.e. referring to death. So very important, let us reflect on death. My second point of reflection, and my second point is about gratitude, shukr. Our beloved Messenger sallallahu alaihi wasallam was a great example for us. Remember, he would prolong his prayer in the night. One day his wife al-Mu'mineen Aisha came to him and said, "Oh Messenger of Allah, why are you doing this? You know, Allah Ta'ala has overlooked your shortcomings and your mistakes." And his reply was, "أَفَلَا أُحِبُّ أَنْ أَكُونَ عَبْدًا شَكُورًا." I like to be a grateful slave to Allah Jalla wa Ala. Now the shukr I'm referring to, the shukr of those who are healthy, the shukr of life. Those of us who are alive, that there needs to be a sense of gratitude and shukr to Allah Ta'ala. But also shukr, because the Messenger of Allah in one hadith, he said, "Man lam yashkur nas, lam yashkur illah." Part of our shukr to Allah is shukr to creation when they are doing good. So those frontline workers, those doctors, nurses, all of those need a sense of gratitude from us, that they're putting themselves at risk for the benefit of the wider community and so on. And my next point of reflection is about tawadu. And why I say this, you know, I live in my community, I work in my community, I share people's experiences, and sometimes you do hear things which I don't think a Muslim would say. You know, my iman is so strong, this won't affect me. I pray 5 times a day, this won't affect me. I'm young and healthy, I go to the gym. You know, look, my diet is so healthy. Our life and good health is a tawfiq from Allah Ta'ala. That should not make us feel deluded and become arrogant. Our beloved Messenger sallallahu alaihi wasallam had a sense of great humility, and he was the best of Allah's creation. He sallallahu alaihi wasallam, you know, with the blessings and favors Allah Ta'ala gave him of Isra and Mi'raj and Nubuwwah and Risala, and he spoke to Allah Ta'ala. He passed the stage where Jibreel alayhi salam could not pass, but yet he was a humble individual. And he sallallahu alaihi wasallam said, "La yadkhulu jannah لا يدخل الجنة من كان في قلبه مثقال ذرة من كبر أو كما قال صلى الله عليه وسلم." A person who has a small amount of arrogance, he or she will not enter Jannah. And my last and final point, brothers and sisters, before I pass on to those who really deserve to be speaking today, our specialist, is about, you know, medical treatment in Islam, medicine in Islam, and also in terms of us referring back to specialists. You know, we have this Islamic tradition from the science of hadith, from the different sciences that we have, and it's about tathabbut. Yeah, Allah Ta'ala in the Quran, what does Allah Ta'ala say? Ya ayyuhalladhina amanu in ja'akum fasiqun binaba'in fatabayyanu. If news comes to you, what do? You ascertain. We are not a community that just, sadly, this has become quite prevalent. A WhatsApp message comes and we spread it. Conspiracy theory comes, we spread it. No, we are, that's not our, you know, our Quran was not based like this. Our hadith is not based like this. Our science of fiqh didn't come through this. So that's sad to kind of like, you know, hear that Muslims are relying on those things to spread conspiracy theories concerning the vaccination. And do keep in mind, the Messenger of Allah sallallahu alaihi wasallam said in the hadith, that someone who hears everything, كَفَى بِالْمَرْءِ كَذِبًا أَنْ يُحَدِّثَ بِكُلِّ مَا سَمِعَ. That it is enough as a lie for a person to hear something and just spread it. That's not our tradition. And very, very important, Allah Ta'ala is telling us, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. Refer back to those who know if you do not know. In this field of vaccination and medicine, as an imam, when people do ask me, I say, look, refer to the specialists, ask them, or let me wait and find out what they are saying so that I can then tell you what the answer is. The Messenger of Allah sallallahu alaihi wasallam, what did he tell us? He said in one hadith, "Man afta an-nasa bighayri ilmin." Whoever gives a ruling without knowledge, لعنته ملائكة السماء وملائكة الأرض. The angels will curse that person. The angels of the heavens and the angels of the earth will curse that person who gives a ruling without basis and knowledge. And the connecting point to this, brothers and sisters, there's a level of positivity. In a sense, Allah Ta'ala is telling us, and the Messenger of Allah is telling us, there will be a cure. There is a cure. We just need to find it. The hadith of the Prophet ﷺ, where he sallallahu alaihi wasallam said, "Ma anzala Allahu da'un illa anzala lahu shifa." Whenever Allah Ta'ala sends a disease, Allah Ta'ala sends a cure. And that's in one hadith, he sallallahu alaihi wasallam said, "Ya ibadallah tadawu." O slaves and servants of Allah, seek medical treatment. With that, brothers and sisters, I really want to leave it to the specialists so I can inshallah benefit from them and yourselves. Thank you for your time. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair. Thank you very much. That was an excellent introduction and leads very nicely onto the medical section with our specialists, starting with Dr. Wajid. Now, he will give us a talk on the current landscape of COVID over the past year. Just to introduce him, he is the chair of the National Muslim Medical COVID Response Group and vice president of British Islamic Medical Association, otherwise known as BIMA, and international director of FIMA Lifesavers. He has a degree in clinical genetics and is a medical tutor in history and medicine, social media and medicine, and has been studying vaccine hesitancy for several years. So over now to Dr. Wajid, please, for your talk on the current landscape of COVID over the past year.
Jazakallah khairan. Can you guys see my screen, the presentation?
Yes, I can see. Thank you.
Perfect. Alhamdulillah Rabbil Alameen, wassalatu wassalamu ala ashrafil anbiya wal mursalin, nabiyina Muhammad wa ala alihi wa sahbihi wa sallam wa alayhi tasliman jami'an kathira. Thank you so much for giving us the opportunity to say a few words on what is turning into a nightmare and is becoming even worse. The only thing worse than being in a nightmare is when a lot of other people don't realize exactly the situation that we're in. So my job is to give you the current landscape. What is the situation? Everyone can read the news, everyone watches TV, you're all getting the WhatsApp messages. So why do you need me to tell you what you already know? Well, hopefully I'm going to tell it to you in a way that might shake those who need to be shaken to take some action, to do something differently if you're not taking it seriously enough. What is the current landscape with COVID? SubhanAllah, at the beginning of when COVID was taking off, you must have heard there was a lot of conversations about flatten the curve, flatten the curve. We need to flatten the curve being the rate at which COVID is rising. If we can flatten it through hand washing, through wearing masks, through social distancing, inshallah, and even through lockdowns, then inshallah the rate of the infections would drop and the rate of deaths would drop. The UK has managed to flatten the curve, but it is one of the few countries in the world that has managed to flatten the curve the wrong way. We flattened it vertically. That means the rate of infections at least a week ago were going up like this. They were going up so fast that it was difficult for any system, including the NHS, which is one of the world's best systems. You might be underfunded, we might have lots of problems, but it's one of the world's best systems out there. It's the envy of many a country in the world, struggles to cope. In fact, hospitals are doubling their capacity and they're struggling to cope. In fact, you're having doctors being pulled out of every other job. You're a dermatologist, you come here. You're working in that lab, you come here. We're all going to be working on COVID. Putting people on COVID rota, leave being canceled. We're still struggling to cope. We're canceling elective surgery. We're still struggling to cope. This is what we're in the situation of, brothers and sisters. We're in a very, very difficult situation now. And I said this before and I'll say it again. This is something that, that we've been talking about Brexit for 2 or 3 years. What we didn't realize is the first thing we would Brexit is safety. The rest of the Europe is like this, and look at where we are, increasing. There really is very few countries in the world, really only America has more deaths, but even per capita deaths, you'll struggle to find anyone that will have as worse a situation as we do. There are more people dying in the UK than in the whole of the continent of Africa have passed away from COVID. There's something wrong, right? We have to take it seriously. If anyone isn't going to take it seriously right now, when are we going to take it seriously? And this is, we're in London and the Southeast. Well, London and the Southeast is peaking. And if you're not from London, if you're watching this from anywhere else in the country, unfortunately, you're next. It's only a matter of time and days before it hits you, nauzubillah. We ask Allah subhanahu wa ta'ala that it doesn't, but we know that this is what the pattern is. And in top of that, ethnic minorities are being affected. Ethnic minorities were being affected more in the first wave. Now that we're in the third wave and we're being hammered, ethnic minorities are being hammered. Don't forget this graph for a second. Let me tell you what an intensive care specialist messaged yesterday on the group. Intensive care specialist who's dealing with all the people who are intubated, who are on the edge now of life and death because of COVID. You know what he said? He said almost every bed has a Quran cue playing on it. When you go into the ward, COVID ward, when you go into intensive care unit, you will just hear Quran playing left, right, and center because they're all Muslim. Not every single patient. I can't say every patient. I'm not saying that. But there's so many of us that we're filling, the mosques are closed and the ITU is open, and that's where your front row is right now. So when are you going to take it seriously? Brothers and sisters, this is getting like, this is beyond the point. 1,500. When I did this same presentation, it wasn't 1,000. Now it's 1,500. When are we going to wait till it's 10,000? These are some messages that we made in early March. We said ITU beds will run out, and if you don't want doctors to choose who lives and who dies, not up to the doctor who lives or who dies, but who gets an intensive care unit and who doesn't, then take precautions. We said that doctors and nurses are dying. Many have died in Italy. And 95% of all the doctors who have died of COVID are from ethnic minorities. Most of them are Muslim. We said that you are going to run into a situation where you will struggle to bury people. You will have to think about mass graves. You will have to think about those kind of fiqh issues that you never would have thought of in peacetime. If you don't believe what I'm saying, if you think this guy is just he's exaggerating, this guy is just taking it out of all proportion, then go ask the National Burial Council, go ask Gardens of Peace, go ask Eternal Gardens, ask them. Because that evidence you can't disagree with. They're struggling. And if your grave diggers are struggling, then you have a serious problem on your hands. Brothers and sisters, we don't need to get to the situation they were in Italy. In Italy, where they had to call the army because they couldn't bury them fast enough, and they just decided everyone gets cremated. Everyone. Muslim, non-Muslim, they didn't care. Everyone got cremated. This is not what we want. The loved ones didn't even get to see. They got a one WhatsApp picture. That's it. That's it. And they were burnt. We don't need to wait for this kind of thing to happen to us before we take it seriously. Right now, I don't know if you can hear this. This was sent by another brother on a group. This is the alarm. When this alarm goes off, people like me who are used to seeing death because of my job, who are used to seeing difficult situations, when you have a shiver run up their spine when they hear that, you know what that means? That means oxygen's running out. And that's not on one floor, that was on every single floor of the hospital. They're not going to give you an email or a WhatsApp message beforehand saying, guys, we're running at 10%, 5%. That's not what's going to happen. When it collapses, when things fall down, it will fall down very quickly, and we will think, how did we get here? Just like we got to the 1,500 dying a day. Brothers and sisters, I'll finish on this point. 1,500 dying a day means it's like 5 or 6 airplanes now falling out of the sky every single night. Every single night. If that happened, we would definitely take very seriously what's going on. What's going on with the airplanes? What can we do to stop this? How can we protect ourselves? Etc., etc. This is what's happening. Every single night, 5 to 6 airplanes full of people are falling out of the sky. I beg you from the bottom of my heart, my brothers and sisters, save yourselves, your families, and your communities. Take this disease seriously. Listen to what the Imam said. Don't listen to those jokers on WhatsApp who told you that it wasn't a real pandemic, who told you that it's nothing worse than the flu, and now who are trying to convince you that when you're on an airplane that's falling down, that when someone's giving you the parachute, they're telling you the parachute's fake. Don't listen to those jokers. Don't listen to those people who share those without thinking. I'm telling you, this is serious. The number of medics who are going to suffer traumatic mental health issues, the number of people who are going to suffer it is becoming evident. People are struggling to sleep. People are struggling to think straight about how they're going to protect themselves and their families. Please follow the rules. Don't take shortcuts. Don't meet up secretly in your homes. Don't look for loopholes. Don't look for excuses. Follow the rules. Make dua to Allah subhanahu wa ta'ala, because in the end, He is the only one who can protect us. He's the only one who can help us. And inshallah, tie your camel. Wa jazakumullah khairan.
Jazakallah khair, and thank you very much, Dr. Wajid. A very, very important reminder for everybody. I think if you work in a hospital, then you know exactly what he's talking about. This is a very, very serious situation. So that was an excellent reminder for all of us. And we now go on to our next speaker, who is Dr. Marjan Jamal. She's a policymaker working for NHS England and Improvement, helping to deliver national health policy on a range of issues facing the health system, including health inequalities. So before working for the NHS, she led this work stream for the all-party parliamentary health group, working in a cross-governmental think tank, where she also led on public health research and development. So a lot of experience at the highest level in public health. She has also worked at Westminster-based healthcare consultancies and NGOs, developing public health communication strategies to inform sustainable policy making across healthcare and medical education. So she studied medicine at University of Manchester and also has a master's in public health. So Dr. Jamal, could you please now give your talk on public health perspective and vaccinations? Thank you.
Can everybody hear me okay?
Yeah.
I'll just get this ready. Can everybody see that? Okay. So I will be giving a broad overview of vaccines, inshallah, looking at some of the global, national and personal benefits of vaccines. So I'd like to introduce everybody to Lady Montague. She witnessed smallpox inoculations practices whilst living in Turkey under the Ottoman Empire, and she was the first to bring this idea to England. So she had her son inoculated 80 years before the first ever smallpox vaccine. The smallpox vaccine eliminated a 3,000-year-old disease from the world. So inoculation practices were the forerunners to vaccines. So what are some of the national benefits that we've had from vaccines? So as you can see, the country has a history of vaccination programs spanning more than 200 years. The current NHS vaccine programs have helped reduce lots and lots of infectious diseases. So a good example of this is polio, which was and still is a serious viral infection that used to be very common in the UK and worldwide, but it's very rare nowadays because it can be stopped with vaccinations. There hasn't been a single case of polio caught in the UK since the mid-80s. So vaccines, oh, sorry, I haven't been sharing this slide. Okay, so that was the first slide. And this is the second slide that I just spoke about. And this is the third. I'm on two screens, sorry. So vaccines have helped and will continue to help us tackle some of the biggest diseases we face over the next decade. So what are some of the personal benefits? Vaccines have meant that we can perform Hajj and Umrah with ease of mind. It has meant that ourselves and our children can study degrees like medicine and nursing after taking important vaccinations. That means we can work with patients safely. And it has meant that we're able to connect with family all over the world when visiting countries that require vaccinations upon entering. So we can see how COVID-19 has impacted the Black, Asian, and minority ethnic communities through many different factors, a combination of biological and social. But for the sake of this presentation, I wanted to just quickly focus on the social circumstances of health, because they are very important as a community for us to think about alongside our physical health. So social and economic health inequalities have been made worse by the pandemic. According to Public Health England, the death rates from COVID in the poorest areas have been more than double those in the richer areas. So if you look at poverty, what does this translate into? So the risk of death from COVID-19 in England and Wales increases with poverty. Bangladeshi and Pakistani and Black ethnic groups are more likely to live in poorer neighborhoods. We all know that Barking and Dagenham at the moment has the highest COVID cases in the country. And it's said that 1 in 16 people are said to have COVID there at this moment in time. And it comes as no surprise that they are also one of the most poorest local authorities in the whole of England. When we look at something like housing, the proportion of Bangladeshi, Pakistani, and Black households experiencing overcrowding was 30%, 16%, and 12% respectively, compared to 2% of white British households. Bangladeshi and Pakistani groups are also more likely to live in multi-family households, which makes it a lot easier for COVID to spread in homes that got the disease. So there's a lot of wider repercussions and perspectives for our communities to think about, which extend just beyond the physical, and vaccines can, inshallah, help us with this. Okay, so what's the problem? This. Dr. Wad gave a very sobering, actually, presentation on some of these statistics. But as we all know, the Southeast and London area has had the biggest increase in numbers. And as experts have described, we're in the darkest days of the pandemic. Dr. Yvonne Doyle from the Public Health England has said that the record daily figures right now has meant that there have been more deaths in the second wave of the pandemic than the first. Another problem. So the British Medical Journal have noted that vaccine hesitancy is generally on the rise, but this is particularly seen in ethnic minority communities. They looked and reviewed a range of surveys which was measuring uptake in different communities, and they found the lowest to be in BAME communities. However, when you look at the surveys more closely, it's apparent that ethnic minority groups want more information and transparency on things like vaccine trials. So a lack of information in that area can create lots of misinformation in the social media, from social media. You can see a statistic here where the Royal Society for Public Health commissioned a poll, and they found that only 55% of Asian participants were likely to say yes to the vaccine. So why is this important? Because Professor Danny Altman, who's an immunologist at Imperial College, says, realistically, we should be aiming for around 80% of the population to be vaccinated in order to benefit from the widespread protection. Encouragingly, the poll does show that participants who were not willing to be vaccinated from the BAME communities very much so welcomed offers of further health information from their GPs. So they are receptive to that. So what can we do? Okay, so we should consider our options very carefully. I know that some of us are scared, and I know our reasons and feelings for being scared, they haven't come out of thin air. The World Health Organization says that vaccine hesitancy is one of the top 10 biggest threats to global health. If I can draw upon a personal example, at first, even myself, I did have thoughts on COVID, and I wondered, how did they manage to produce the vaccine so quickly? So I did some digging, and I found an excellent and easy to read article that can be found on The Guardian by Professor Adam Finn, and he lists the top 10 reasons as to how the vaccine was produced very quickly. So if, like me, you've had similar thoughts, I encourage you to have a read of that. But we're also very lucky today because such science-related queries will be covered by our lovely clinicians on the panel. So I know there are other worries as well, which actually may be misrooted in mistrust of government, health authorities and institutions. And this isn't something new and has been the case since the beginning of vaccines. So this can mean that sometimes our worries are actually more about our relationship with the society around us rather than biology and chemistry, in which case all the science in the world might struggle to convince us otherwise that we should take the vaccine. And in an ideal situation, we would have the luxury of time, clarity, and influence. We would be working with the lawmakers and the psychologists and the healthcare workers, business owners, hairdressers, shopkeepers, butchers, the general public, to try and address some of these issues that make us believe that we can't trust authority. But right now, in the absence of time and support to do those things, here in January 2021, with over 100,000 deaths from COVID under a year and our country in crisis mode, we have to be pragmatic and respond in the best possible way we can right now. We have to do what we can to look after ourselves and each other right now. So 3 things we must remember is that COVID is the danger. If we get COVID, the risk of it making life horrible for us and our loved ones outweighs any theoretical risks of any vaccine. Secondly, we should hesitate before sharing and believing information about vaccines that have not come from a reputable source. We should be humble about our knowledge limitations and seek expert advice. All the hadith that we follow and we base our everyday on is based upon expert confirmation, corroboration, and trusted sources. And thirdly, we all have a big part to play in tackling misinformation. Whether our worries are psychological, political, medical, or spiritual, we have to collectively work together, as this is not just a task for the government or healthcare professionals, but it's a task for us all. Even the local barber plays a really important role in promoting public health messages to his customers. Our community stands to benefit greatly from stopping the spread of COVID. So we should take a step back and see that vaccines have been around for a very, very long time, and they have saved more lives than any other medicine. Unfortunately, this is an infectious and contagious disease, so we can't turn a blind eye and bury our heads in the sand if we choose not to take the vaccine, because we can then pose threats to others. We know vaccines are not a magic bullet, and they won't make all our problems go away, but our individual decision to not vaccinate can have consequences for those around us. So we need to really understand this when we make our decision. 2 objectives of public health interventions complement 2 beautiful objectives of our faith, which is the concept of looking after the jama'ah, i.e. the community, and preservation of good quality of life. We don't just think about ourselves, but also the benefit of those living around us. And we don't think just about living, but we think about living well. We understand that nothing in life is perfect, but we weigh out together the risks and benefits together to keep society healthy. So of course, it's important to stress the country and the NHS is dealing with a mountainous burden at the moment, and we still have to socially distance for now, whether we have the vaccine or not. The single best thing we can all do today and tomorrow, as vaccines are being rolled out, is stay at home. Remember, COVID loves a crowd, and pray that our loved ones remain safe. And inshallah, when the time comes for us to be vaccinated, we can make a choice based on the right information. So where can I learn more? Off the top of my head, these are some excellent suggestions for us to learn more from. For those of you living in Bromley, I will be working with the local council COVID task force to inshallah keep our communities connected to the right information. And from what I've seen, organizations like the British Islamic Medical Association and MCB have been doing a lot of the hard work, consulting and combining scientific evidence with Islamic evidence, which is a win-win, and what more could we be asking for? So to conclude, I really hope that we can keep the conversation going so we can help each other, inshallah, navigate through the dark days. And, finally, inshallah, it won't be too long until we can get back to all of this. Thank you for listening.
Jazakallah khair. Thank you very much for that. So we're getting some questions coming in, which we will hope to answer during the Q&A session after the talks. But that was really interesting, the data on, particularly on the hesitancy for vaccination, but also the fact that the danger of the actual infection greatly outweighs any side effects of the vaccination itself. So that's a very important point to bear in mind. Now, we will now go on to our next speaker, who is Dr. Javed, who will be giving a talk on the current vaccines being developed. I know there's some questions coming in already on that, so hopefully those will be answered with his talk. And Dr. Javed is a consultant virologist and head of microbiology at Mid and South Essex Hospital NHS Foundation Trust, and also is an honorary consultant virologist at King's College Hospital in London. So his talk is on the current vaccines being developed. Dr. Javed, please.
Thank you. Assalamu alaikum, everybody. Alhamdulillah Rabbil Alameen. Praise be to Allah, the Rabb of the worlds, and peace and blessings on the best of His creation, sallallahu alaihi wasallam. It's an honor and privilege here. Thank you, Imam Shakil, Professor Ejaz, Dr. Omar, and very pleasant experience to share with the other co-panelists, Dr. Marjan and Dr. Wajid. It's a honor and privilege to be invited and to speak to the wider audience. Again, Assalamu alaikum again. With respect to the vaccines, how did we arrive here, and what has happened in the last 12 to 14 months? Most of you are aware that we have sadly had this SARS-CoV-2 emerging in Wuhan, China in the end of 2019, which actually quickly spread across the globe, becoming a pandemic in March 2020 and affecting globally, irrespective of whoever they are, wherever they live, all the rich and the poor, non-discriminatory, but at the end of the day, it's the poor people who get affected the most, whether it's directly due to the virus or it's indirect effect of the virus. So what's happened, I mean, it's there is a cloud, there is a silver lining in every cloud, and there is a hope in all this despair, which is the most current hope is the vaccines. And how did we quickly arrive at this kind of vaccines is a key question within a space of 10 to 11, probably less than 10 months. Now, what happened when the Chinese CDC, which is works very similar to the American CDC, published the genetic code very quickly? I think it was in the beginning of the second week of January 2020, and that was a huge blessing. And immediately, the scientists who were working on the mRNA vaccine quickly grabbed that, and even the other scientists. Now, taking a few steps back of the mRNA vaccine and the other new generation vaccines, it's not true to say that it's only a year of research in these vaccines. The mRNA vaccines, the scientists have been working in the last 2 to 3 decades. Particularly in the last 20 years, there has been an extensive work on the mRNA vaccine, but due to various reasons, to get this into the public domain, it couldn't get approved because of the fear of what could go wrong. And many of those scientists, unfortunately, had to stop their research. The one famous example is the MERS-CoV, when it emerged in 2013, and quickly became a major problem in the Middle East and a major problem for hospital-acquired transmission of MERS-CoV, particularly in South Korea. There was a huge interest. And then it was nearly a vaccine was developed, an mRNA vaccine was almost developed, but when it was realized that it's not a major public health problem for other countries, it was laid off, and sadly, that was forgotten. And when this appeared, it was all the hard work didn't go to waste, and those scientists quickly picked up the model of the MERS-CoV, which is very similar to the SARS-CoV virus, which causes COVID-19. Now, mind you, in the background, there was an original SARS-CoV in 2003, which fortunately it disappeared from the world screen within a matter of 18 months. And largely that was because of public health, the way the public health worked, interconnected across the world in 2003 and 2004. And also for the fact that SARS-CoV, the original SARS-CoV in 2003, was spreading only after patients were becoming symptomatic. So it was easy to isolate those who were symptomatic patients. Whereas now with this new COVID-19 SARS-CoV-2, unfortunately, even when patients are pre-symptomatic or asymptomatic, can actually potentially transmit the virus to susceptible host. With that, this SARS-CoV-2 is very closely related to the original SARS-CoV virus. So there was this knowledge that because the way the virus works is that viruses have either an RNA or a DNA. They don't have both. And SARS-CoV virus is an RNA virus, which means it has got its genetic code, which is relatively large. What we call it has 30,000 nucleotides, meaning to say what you might have read, something called base pairs. So it's got around 30,000 nucleotides. And for someone to say that this virus was designed in the laboratory deliberately and released into the world is not only rubbish, is impossible, because somebody has to be a million miles cleverer than the best virologist on the planet to do that. It's next to impossible. It's just like if you have a Lego puzzle in a bag which is all jumbled up, and if you just shake it, you can't actually have a virus. You can't actually have a ready-made airplane from a Lego puzzle kit. So somebody to design the virus is impossible, and somebody to design the virus so that it is specifically infecting the upper respiratory tract is again next to impossible. So we knew as a matter of fact that these coronaviruses, because the coronaviruses have been circulating probably for a millennia among the human beings. There are other medically important coronaviruses, and we think possibly at some stage in human history, each of those coronaviruses probably did the same thing what SARS-CoV-2, which was COVID-19, is currently doing. So we had this understanding that the SARS-CoV-2 has got something called a spike, which and every virus needs to enter inside a cell to replicate. And to do that, it has to enter the cell, and not all the cells have the gate to say that yes, you come on in. So most of the cells don't have the gate. So for the virus to enter inside the cell, they need to have a receptor. So the spike acts like a key entering in, which helps the virus to enter inside the cell, and therefore, once inside the cell, the RNA is released into the cytoplasm, and then it does its job, which basically is to manufacture some more proteins, what we call as transcription, and then translation, and then an assembly of the virus, and then emerging out of the cell and infecting other neighboring respiratory cells. So that's how SARS-CoV-2 works. So with this knowledge, in the last 2 to 3 decades, that the spike helps the SARS-CoV-2 binding into the receptor domain. So it was a kind of a common sense to produce antibodies. So, or we can try to produce a vaccine which can produce those antibodies which can block the entry. So basically cut off block the spike into attaching into the cell. So with that knowledge, the scientists worked out the code which codes for the spike protein. So all the vaccines which are currently available, and most of the other vaccines which are being currently worked, they all seem to target only the spike protein. So the 3 vaccines which we have currently in UK, the Moderna, the Pfizer, and the Oxford ChAdOx1 vaccine, all bind to the spike protein, preventing the virus entering inside the cell. How do we very quickly arrive here with that knowledge? If we had to produce a traditional vaccine, like how we have been doing for the last 300 years, if we had to use that kind of a measure here, we would have been much more late. Middle of last year, the expectation was the first vaccine for COVID-19 would be probably available end of 2021. But miraculously, I mean, because of the mRNA vaccine scientific knowledge, they did what we call as experimental trials, which was preclinical trials, successful preclinical trials. Then very quickly, what we saw was at the end of last year, randomized control published this double-blinded Pfizer, Moderna, and the AstraZeneca trial, successful trial, which showed particularly the Pfizer and the Moderna more than 90% efficacy in preventing COVID-19, and the AstraZeneca at least 70% in preventing, in mounting an antibody response, a neutralizing antibody response against the spike protein. So all I'm trying to say in a nutshell is that do not think that the research gone is just probably years of research. Is 20 to 30 years of research has been invested in this mRNA vaccines, particularly the mRNA vaccines. Now, one may ask, why did we produce it so quickly? And because we are in the middle of the pandemic, there was an urgent need. People, it was not it shouldn't come as an unexpected that there are so many deaths in Europe in the winter, and there was a need that we should have this vaccine at least. Try to prevent as many deaths as possible. So normally what happens is when we get a new medication, like for an example, a vaccine into the public domain, the vaccine production, the vaccine will go kind of a linear way like that. But in the last 10 months, everything was condensed. So many of the countries across the world, particularly United States and China and Europe, I mean, they invested billions, particularly Americans, in the Operation Warp Speed. $18 billion were pumped into the vaccine research. That's one credit which we need to go to Trump in his last 4 years of presidency. So there were different vaccines, different vaccine formats. Some are protein peptide units, some are mRNA, some are like this non-replicating Oxford vaccine. So, and there are so many other traditional vaccines which are currently being researched, and the hope is that these new vaccines will all be available at least by the middle of this year, if not if not early this year. So different vaccine, different formats, and one thing what we need to be aware of is these mRNA vaccines is actually, I would say, for our community is a blessing. If we go back to the traditional vaccines, particularly the live virus vaccines, like the flu vaccines, which we use in the nasal flu vaccine for children, they have got certain contents which we cannot escape. For example, gelatin contains obtained from porcine sources, and we cannot avoid that because there is a live virus there. But with this mRNA vaccine, these mRNA, they are produced synthetically. They are not derived from a live virus. They just have the mRNA code which codes for the spike protein. The way it works, the mRNA is delivered by a liposome, which is basically fat, liposomal cholesterol, a nanoparticle, and that is the mRNA is encased in a liposomal chromosomal particle, and it is given as an intramuscular injection. Once inside muscle cells, then it goes inside the cytoplasm. Now, the reason why I'm saying is cytoplasm is some of the people have been worried that these mRNA vaccines can get integrated into the host cell chromosome, and therefore it can be a problem. Number one is that mRNA vaccines, they are self-degrading, meaning to say within 7 to 8 days, there's no more mRNA left. And secondly, the mRNA, which transcripts of proteins and translation steps happen in the cytoplasm. They do not happen in the nucleolus where the chromosome has to be integrated. Number one, it's not a DNA virus, it's a mRNA. Number two, it's happening in the cytoplasm. And number three, it self-degrades. So this is all like this is all reassuring for, and it dismisses the myth that these vaccines can somehow get integrated into the human and can cause problems. So there is no evidence for that. It's what we know, for as a matter of fact, up to now, and we know that more than 2 million people have been vaccinated in United Kingdom alone, and there have not been serious adverse effects reported from neither of those 3 vaccines. So, which is reassuring. Obviously, no one can say what happens in the long term because we simply don't have the data, and we cannot have that luxury. Let's wait for a vaccine to, let's wait for 5 years, let's wait for 10 years. I have to tell you that the previous vaccine, which was fastly developed in rapid pace, was the mumps virus vaccine, but even that took 5 years. This is 10 months, and these are highly efficacious vaccine. Middle of last year, even up to October last year, if a question was asked to experts, what do you think would be the efficacy of these vaccines, any of the vaccines, one would have expected the flu vaccine in a good season, when the flu vaccine is very, very well matched vaccine, then the efficacy is 60%. So we would have expected the COVID-19 vaccines to be around maybe 60-70%. But lo and behold, it's such a we are so fortunate to have these mRNA vaccines more than 90% efficacy. So we got a tremendous efficacy, and also the evidence is mounting that even despite after 4 months, the neutralizing antibodies in all these 3 vaccines do not seem to wane that quickly as one would have anticipated. So these are highly efficacious vaccines as of date. And if you look at the contents, the ingredients of these vaccines, particularly the Pfizer and the Moderna vaccine, which are the mRNA vaccines, there are hardly 5 to 6 ingredients apart from the mRNA. So, and none of them are animal products. And none of them contain any of those, what people, the anti-vax people would claim, thiamarosal, nothing of those. So ingredients are safe. The adverse effects of these vaccines are quite, when compared to any other standard vaccine, they are similar. And most of these adverse effects happen very quickly, like say, pain around the site of the injection area, some redness, some swelling in people who had some of the complaints of the vaccine. There has been some scare of the Oxford vaccine. Middle of last year, there were cases of transverse myelitis. Now, for viewers who are not from medical background, transverse myelitis simply means inflammation of the spinal cord. And there were 3 cases of transverse myelitis in the Oxford vaccine group, but one of them was in the placebo, meaning to say those who did not receive the COVID-19 vaccine. And the other 2 happened in the vaccine trail group, but one of them already had multiple sclerosis, and there was this one case of transverse myelitis. But as of now, with this so many, more than 2 million doses, there has been no reports of transverse myelitis in any of these 3 vaccines. So that's a brief summary of the vaccines. Now, how do these vaccines work? Once injected into the cytoplasm, the mRNA, once code for the proteins, they present on the cell surface, and subhanAllah, the immune system is amazing. There are lots of things which we don't understand, but what we understand is there is something called what we call as dendritic cells, and these dendritic cells are like policemen. They are looking for trouble. Who is mounting trouble, and they'll keep roaming across the body. They are present on the skin, and they're present inside what we call a dendritic cell. They are like antigen presenting cells. So basically, they recognize this. They take this the protein which has been presented on the cells from the mRNA. They take it to the lymph nodes, and from there, there's a link between the B cell immunity, what we call as humoral cell immunity, to the T cell immunity. And the T cell immunity is very important because that is the one which retains the memory. And there have been few evidence which has been published end of last year to say that the memory which has been elicited from the mRNA vaccines is more potent than somebody getting a natural infection. So even individuals, those who have had the COVID-19, they may say, well, I had COVID-19, so I had a natural infection, so I'm naturally immune. That's not true. It may be true, but we don't know how long your immunity may last. it's wiser to have this vaccine, because even in those individuals who had a natural infection, it boosts the T cell, both the T and T cell immunity, and that can be longer lasting in terms of protection. Now, sorry.
Sorry, I have to stop you there.
Thank you.
I think we can come back to you because there's several questions on this topic. Most of the questions are on this topic, but I have to go now quickly to again to Dr. Wajid to finish off the talk. So thank you very much for that. It's very thorough, and we'll come back to you. I'm sure you'll be explaining a lot more quite soon. But Dr. Wajid will give the final talk on the myths surrounding COVID and vaccines. So Dr. Wajid, please.
Assalamu alaikum, jazakallah khairan. Just going to share my screen again. Where's my screen? There it is. Jazakallah khairan once again. So I appreciate all the talks that are given by my colleagues, and it's my chance to just talk about some of the myths. There's a few points I want to make first. Why are there myths around? And it's not just the Muslim community, it's everywhere. Muslim, non-Muslim, if educated, non-educated, medical, non-medical, the myths are around everywhere. And that's because this is one of those events that there's a lot of information around. And it's easy for some of it to be misunderstood. It can be confusing. And things are moving at such a fast pace that sometimes what's true and what isn't is difficult to differentiate. And especially at the time of social media and people with other agendas that are out there, that it makes more myths available. So the first question you need to ask is, who do you trust? Because I could tell you whatever you want about the myths, but you could turn around and say, who are you? I never met you. I don't know who you are. Why should I trust you? And even if you did meet me, and even if you do know me, why should you trust me? Because there's somebody else equally smart who might be saying something different. So who are we? Who am I speaking on behalf of, which is the British Islamic Medical Association. So the British Islamic Medical Association is a group of Muslim healthcare physicians from across the country, different ages, different genders, it's not just all brothers, alhamdulillah, different nationalities, different ethnicities, some who have trained overseas and they're working here, some who have trained over here, different parts of the country, different specialities. As you can see from the panel is very varied as well. Some of them may be BEMA members, some of them are not. It's not a problem. But there's about 4,500, 5,000 of them, of us have come together and created an umbrella body about 5-6 years ago for exactly this reason. Not because we thought there was a pandemic coming, but so that when the Muslim community asks a question, who is too sick to fast? Before, you just have to go and grab the nearest doctor you find and hope that he has an answer. Now, we can all come together and give a considered medical opinion. Who is too sick? And then the scholars can make a decision on that. Organ donation. Is it necessary? When is it necessary? When is it not necessary? All these kind of questions. There's so many issues about the healthcare of the Muslim community. And this is not one person's opinion. This is not one type of person's opinion. This is hopefully, inshallah, a kind of Jama'ah opinion of Muslim healthcare professionals, people who are part of your community, who pray in the same mosque as you, who are part of your families, and are also part of the healthcare profession as well. That's what it is. We're united. Inshallah, we're inspiring, and we're trying to serve the community as our brothers and sisters all over are. We're very proud of them. We work with all of them, alhamdulillah. So this is why we're hoping that this opinion that we're giving is not just the opinion of a person on WhatsApp. Most of those people, unfortunately, are not healthcare professionals. Many of them are herbalists, naturalists, when you look into it, because in some countries you can get the title of doctor by being an osteopath or something like that. Many of them have been struck off, and many of them, unfortunately, in any profession, just like, if you take 1,000 doctors, 1,000 lawyers, whatever, you'll find a few who are on the fringe. they are on the fringe. But the majority of healthcare professionals agree on the majority of issues that come up in the FAQs. So I'm not going to go through all of them because actually there's so many, there are too many to go through. But I will show you one thing. I'll show you our COVID vaccine hub that we have. Wait 1 second, where is it? My desktop. I'm sorry, I know this is really messy. I can blame my wife, it's her desktop. Here we go. I'm hoping you guys can see. So on the British Islamic Medical Association website, britishima.org, there's a hub for a vaccine hub for myths. What we're doing is we've put our statements here. We've this webinar and any other webinars we're going to put up here, inshallah. You can request an expert speaker, and we answer quite a few of the common myths that are out there. Are GPs making money from COVID? COVID is no more dangerous than the flu. COVID vaccine causes irreversible side effects. COVID is caused by 5G. Vaccine contains aborted fetal cells, or the ingredients are haram. All these myths, they're there. And we've answered them in a very short graphic that you can share on your social media, that you can share on your WhatsApp with references. And if you have any extras that you want, we can address them and then add them on as well, inshallah. So I'll just pick one or two just to give you a flavor from the questions that you were having. For example, how did they come up with the vaccine so quickly? It's, you know, we've come up with the vaccine so quickly, and it's been 10 years and we don't have a vaccine for other things, or 50 years we don't have a vaccine for HIV, but we got a vaccine for COVID. As any lie, the best lies have a small grain of truth in them. That's the best lie, right? And there is a principle, and Imam Shakir will tell me, will correct us, that shaitan likes to stand half in the shadow and half in the light, not completely in the shadow, because that's the most confusing part. So similarly, when people want to spread false information, the way that they'll do that is they'll give you something that's half true, and then they'll add in something that is untrue. This is when somebody's spreading deliberate false information, having misunderstanding. I'm not saying that that's shaitani in any way. I'm not saying that that's reprehensible. If you have questions, ask. If you're confused, ask, challenge even. But when there's some people who are spreading deliberate misinformation like that, without asking the people who may know, like the Imam said at the beginning. So for example, these vaccines were developed quickly because in the same principle, and I use this example because people will understand it. If you break your leg, if you need to go for a knee replacement surgery, you will have to go to your GP, make an appointment, then have an x-ray, then he'll say, yeah, I think you might need a knee replacement. Then he'll send you to the surgeon, you'll see the surgeon will do a scan, a further scan, then he'll say, yeah, I think you need surgery, then you go for the pre-op, then you have the surgery. And that whole process can take you 6 months, 9 months. But if you break the same leg in a car accident, within minutes, you may be on the operating table. Or if you burst your appendix, within minutes, you'll be on the operating table. Now, are you going to turn around and say, no, this is too fast? How did the ambulance get to me in 9 minutes? You know how long it takes the ambulance to get to drive to the local hospital? It would take 25 minutes. It got here in 9 minutes. I don't trust it. I want it to take full 25 minutes. Nobody would say that, because everyone understands that when there's an emergency, time gets compressed. There's more money thrown at it. There are more people thrown at it. There are more resources thrown at it. You go to the front of the queue. That's what happened with the vaccine, brothers and sisters. It's not complicated. It's not rocket science. There are so many people dying per day, so people are going to try and get the vaccine out quickly. That's what's happened. Or let's talk about something else. What are the ingredients of the vaccine? The vaccine contains haram ingredients, or the vaccine contains terrible ingredients. They're going to kill you. Brothers and sisters, you ask the people who know what's inside the vaccine. These vaccines don't contain haram ingredients on their own. There are various ulama bodies who have looked at it and said that this is halal. In fact, my theory is that the vaccine companies have gone out of their way to ensure this so that it's not rejected by Muslims, because Muslims often are vaccine rejectors on this point. People say that it's got fetal cells in it, but they don't understand that the fetal cells that were used for some vaccines, were not even involved for example, the Pfizer vaccine, but were used for some vaccines, were cells that you were used in the 1970s. Those cells are not existing anymore. Those cells don't exist anymore. They were used in the 1970s for to make a cell line. And even the descendants of those cells are removed from the vaccine product. So these are just some of the myths that are out there. I think what might be better is if we go to the FAQs, people can ask, Dr. Umar, inshallah, asks us the questions and we can rapid fire go through them. But if you want to go and find out accurate information, I would tell you to do one of three things. On the vaccine issue, I would tell you, please, brothers and sisters, this is my main information to you. Number one, COVID-19 is a killer. I hope we've made that very clear. I hope the number of, unfortunately, deaths and people suffering is focusing minds to make us believe that. Number two, seek information from trusted sources. Who should you trust? Your local healthcare physicians, your local scholars. They're here. You don't trust anyone in this panel, go trust your local doctor. The same people you trust with your life when you have a heart attack. When you have a heart attack, you go and see them. When, Nauzubillah, your children need surgery, you go and see them. When your parents need medicines, you trust them. If you don't trust Big Pharma, don't trust them. That's fine. It's understandable. Although you do take all their drugs anyway, by the way. You know, it's not like paracetamol is made by the co-op, right? It's made by the pharmaceutical industry. So if you don't trust this big pharmaceutical industry, I understand. There's reasons not to trust them. They have a profit motive. They have had episodes in their past that are deeply questionable. If you don't trust your politicians, I understand. There have been times when their politicians may have lied to you and that you feel let down. But if you don't trust your healthcare professionals, then there's a very big problem that's happening then. Not because, oh, we should be trustworthy above everyone else, but because then you're going to jeopardize your own health. These are the people who treat you when you have a heart attack. These are the people who look after you when you have surgery. These are the people who are there for you in your when it comes to your health. They did not suddenly become traitors to you, to their families, to the ummah, to humanity. So go to trusted sources. You definitely know them more than you know some random guy on WhatsApp. And there are many of these randoms, by the way, they're popping out of the woodwork. And wallahi al-azim, like I'm telling you right now, they've gone very quiet when the 1,500 people are dying a night. Where are they? With their big words and their long mouths and their subhanallah akhi and all this stuff that they bring out left, right, and center. Where are they? I want to know where they are. Hiding in their holes right now when we're burying our dead? Number three, you are in control. No one's putting a gun to your head. No one is forcing you. It is your choice. This is not a dictatorial regime where you are going to be forced to give it. Your choice. All we ask, all we beg is make this decision on the correct information. Don't make it on incorrect information. That's all we ask. We're not saying have it at all costs. We're not going to force it on you. Make a decision, because not only your life and your health is at play, but as Sister Marjan said, every individual at this stage is also making a decision for the health of other people. Odds are that those people who get infected don't usually die. They usually infect other people who end up dying later on. So you're making a decision based on other people, so make sure it's a good one. May Allah subhanahu wa ta'ala reward you all. Please forgive me if I came across as a little bit emotional, but my job here is to shake people into listening a little bit, inshallah. I don't want to denigrate anyone. I don't want to put anyone down, but please listen to trusted sources, inshallah, and let's take this seriously.
Jazakallah khair. Thank you very much for your talk. Thanks for all the speakers this evening. We've got a range of questions. We'll try and do our very best to answer as many of them as possible. I think some of them have already been answered through some of the talks. I want to start off by asking Dr. Marjan, actually, because there's been a couple of questions on the article which had 10 points on how the vaccine was developed so quickly. Was that in The Guardian, did you say, for the viewers?
I think I shared it. It should be shared with the panelists. Yeah.
Okay, so, and I think that another question was, will this talk be available later on, just to go through again for people? Are we recording this? Yeah, okay. So it will be. So you'll get a chance, the viewers will get a chance to find out what the article was. Okay, so I think the next round of questions will be for Dr. Jaweed. I think most of the questions are on the actual vaccine and vaccination. He's answered quite a few of those questions already in terms of whether it's haram or halal. We know it's halal from what he's spoken about, and also Dr. Wajid as well has clarified that on behalf of BIMA. The side effects have also been discussed. There was a question on deaths that I don't think there's been any deaths relating to the vaccination, and the important point was made that the killer is COVID. So the risks of deaths due to the actual COVID greatly outweigh the risks associated with the vaccination. So more specifically now, question for Dr. Jaweed, some of the questions coming in on the individual vaccines. And there's been a bit of confusion because people are saying, is it okay to have one type of vaccine first, like for example, BioNTech, and then the AstraZeneca one for your second shot? Because I think that's been offered in some places. The other issue is the delay now between the first and second vaccination. Will that affect the efficacy or the effectiveness of the vaccination if you leave so many weeks, more than 3 weeks between the two shots? Will that affect the effectiveness of the vaccination? So the first question was, can you mix and match between vaccinations? And what would be the effect of a delay between the first and second vaccination?
Thank you, Professor Ijaz. Thanks for those questions. And just a disclaimer, I do not have any conflict of interest. No money shared between any of those vaccine manufacturers. And a second disclaimer is I am not qualified to give any religious declaration of haram and halal. That's up to Imam Shakil and the other experts to do that. I can just tell you what I have gathered from the virology aspect of these vaccines. Regarding the first question, which is basically the interchangeability, can we interchange between the different vaccines? What we know is all the three vaccines, at the end of the day, they work similar. The mRNA vaccines and the ChAdOx, one Oxford AstraZeneca vaccine, eventually, although it's a non-replicative, it's chimpanzee adenovirus vector vaccine, but basically inside the cell, it boils down to it codes for the same spike protein genetic code. So one may argue that one can mix and match, but however, science is evidence. We require evidence whether interchangeability can guarantee the same efficacy. Now, obviously, we do not have the data. Moving down, maybe by mid of this year, we will have some of the data available to reassure us that interchangeability can be done. But as of now, there is no evidence to support that. I would advise not to mix and match the different vaccines. If they had a first dose, they stick on to the same manufacturer for the second dose. However, if there is a scenario where pragmatically somebody has to make a decision, then what should they do? I would say we have to do a risk versus benefit for a case-to-case kind of for example, if there is an elderly individual and the risk of dying if they contract COVID-19 is higher, then I would say, and if they don't have any choice of not having the same manufacturer, then this is just an example I'm giving where the benefit outweighs the risk in having a different manufacturer. But I have to underline the statement, I'm not recommending interchangeability of the vaccines. It has to boil down to case until we get that evidence. Probably it may come in the middle of this year. Now, with respect to the second question about delaying the vaccine, we have to appreciate why the manufacturers have done 3 weeks for Pfizer and 4 weeks for Moderna and Oxford. There is some immunological basis for that. Number one was there was an urgent need to get the data out, urgent need to show that they're highly efficacious. And number two was that once somebody has got a priming dose, once the immune system is primed, both the T and the B cells, there are effector cells which need to go away, number one, and that takes at least 3 weeks to go away. And number two is that we need to give a big knock on the memory cells to waken up and ask the memory cells to proliferate and produce highly refined, which counters the SARS-CoV-2, what we call as affinity maturation. And the immune system, subhanAllah, works that way, where once they are given the second dose, which we call as a booster dose, that elicits very highly specific antibodies. And the idea of these vaccines recommended by the manufacturers 3 weeks or 4 weeks is that the second dose, when it is given at the time, what they have done in the trials, boosts the, we know for a fact, boosts the immune system. Like, for example, the Oxford vaccine, if you look at their phase 1 clinical trials, when they published, they looked at specifically what's the difference between 1 dose and 2 doses, if you go in the first paper. And the units of the antibodies which were measured after the first dose was 8,000. And when they gave them the second dose, the units of antibodies mounted from 8,000 to 61,000. Now, one has to make a judgment whether, I mean, these decisions are leader-based. We can just give this data. Now, some of the leaders in this country have made that decision to delay, but most of the other people, WHO, FDA, and the manufacturers have stuck to the. I think if I am to give an opinion, I would rather side with the manufacturers and with the majority of the experts, particularly on the other side of the Atlantic, who have been very vocally saying that we should stick to the manufacturer recommendations. There is some truth with what the scientific body is doing in this country, but the fear what we have if we delay, the biggest fear is that where that boost, where that antibodies may wane off, because no one has studied effectively for a long time. What just one dose? How long how long is the longevity of such antibodies? Whether they disappear in 2 months. Who knows? I mean, even it may, we may not know, they may disappear in 10 years, but we don't have the data to support that evidence. So what the British scientists have done is that they have made more of an epidemiological decision to get that herd immunity, rather than making a scientific or orthodox virological decision. So I'm afraid there is no black and white answer. Leaders make decisions, and it is there. And I can understand why the British scientists have made that decision. I can appreciate where they're coming from. But no one can guarantee the longevity as of today. 14th of March, 14th of January, maybe in a few weeks, in 8 weeks' time, we will know better of the longevity of the vaccines.
Thank you much, Dr. Javed. I think you're going to be busy tonight, so the next round of questions are for you as well. I think the next round of questions can be summarized as vaccination and comorbidity. So people are asking, is it okay to have the vaccine if you're thinking of starting a family? Is it okay to have the vaccine if you're with child or breastfeeding? These sort of things. And does it interfere with any medications?
Okay. Thank you, Professor Ejaz. When these trials are done, the first trials do not include children, do not include pregnancy. And that's obvious. They'll never take the risk. All the 3 vaccines have not been studied under children less than 16 years. Now Pfizer is undergoing a trial for children above 12 years, hopefully, which will be published soon. Neither of these vaccines have been studied in pregnancy. But these are mRNA vaccines, and even the Oxford vaccine, the Oxford vaccine, theoretically, we can say that there are no serious adverse effects. They are not known to be shed in the breast milk. And because these are self-degrading mRNA within 7 days. In pregnancy, as of now, the JCVI, which is the Joint Committee of Vaccination and Immunization of Britain, recommends make a risk versus benefit. Okay, and if there is a risk is higher, which will be higher in pregnant individual, then the recommendation is to give the vaccine. Because these are not live vaccines, they are not going to be transmitted from one person to another. For example, the best example I would say the shingles vaccine. So there is a live virus there, but this is not a live virus. So a vaccine recipient cannot transfer the vaccine to the secondary contacts within the close contacts, such as the family members. Now, the other thing is that, again, the vaccine has not been studied in immunosuppressed individuals. Immunosuppressed individuals are obviously at a higher risk. But what we are not sure is how the efficacy is in immunosuppressed individuals. Okay, rather than we are not saying it is unsafe. We are actually saying immunosuppressed individuals should get a vaccine, but whether it is going to be efficacy or not, we do not know. It's too early to say. Like in my hospital, I have recommended all the hematology patients, the hem-oncology cancer patients, to have the vaccine. But whether it is efficacy or not, that we are not sure. We don't have the data. I hope that answers some of the queries.
Thank you very much. And just the last round of questions for you. I'll give you a break after this. The viewers are also asking about you've spoken about the long-term effects. We can't really say short-term effects you've spoken about. What about, this is a very good question on, once you've had the vaccination, should you still take precautions? And what about people who refuse to take the vaccination? Where do they stand?
I'm glad you asked that question, Professor Ijaz, and whoever asked that question. I think that's the key message of this whole talk, to address people who are bordering on skepticism of the vaccine. The vaccine is highly efficacious from the randomized control test which is available on the public domain. Now, the vaccines, they work because the very idea is to get the herd immunity right. Okay, middle of last year we were thinking probably 50 to 60% herd immunity would be fine, but then that slowly evolved into 70%. Now the experts are saying, on the epidemiologic point of view, at least 80% should be, the herd immunity should be developed. If people decline vaccination, then even in a country, for example, like UK is a forefront in vaccine campaign across the world. Even in a country like in UK, we will have pockets of gaps of herd immunity. So what may happen is, if you have 80% of immunization by the end of this year, there will still be pockets of people who have declined vaccination. And in those pockets, you will find surge of cases within that community. For example, I'll give you an example like Newham Council. I understand majority of the residents there, elderly have declined vaccination. Now, what would happen is, say, when there is a surge happening, say, even if they escape this surge, then the later surge, then they are the most vulnerable, and then you might have pockets of a high number of cases to give an analogy, is that you have to think like a dam. A dam may have a few cracks. Okay, when there is normal rain, average rain, the dam wall is not going to crack. But when there is an outburst, like a monsoon of rain, a flood of rain, then at that point, those cracks, those individuals who declined the vaccination, they are going to be the cracks in the dam. They are going to cause the dam to burst, and then you'll have a flood again of a surge of cases. Where COVID-19, the case fatality rate is less than 1%, 0.5%, and yet we see the NHS overwhelmed with admissions, and we are not able to cope. And it is those, unfortunately, what's happening now is the people who are declining the vaccination are the ones who are who should be the number one to be vaccinated. And these are the cracks in the dam. And when again, even if we survive this surge, then in the later on surge, they are highly vulnerable to get COVID-19 and possibly even die. I hope that answers the question. I forgot, there was another aspect of your question. Sorry, just remind me.
So I think trying to remember myself now. So there was the aspect about side effects to medications as well. Are there any side effects to medications?
Okay. Oh, you mean say interactions?
Yes.
The ingredients in the vaccine are less than a handful, half a dozen ingredients, and to the best of my knowledge, these do not interact with any other medications. Immunosuppressed individuals, individuals who got a very naive immune system, even they can receive this vaccine. There's no contraindication for individuals from a medical point of view to decline vaccination, apart from children and you could say pregnant individuals. So there's no specific contraindication from either of. The only specific contraindications I know is that if we are allergic to any one of those ingredients, then such as anaphylaxis, then we are cautioning them not to have that vaccine.
Okay, thank you very much. I think the next questions will be to Dr. Marjan Jamal on the epidemiology. There's questions coming in about why is the infection rate so high in Britain? You know, if we are getting such a high rate that it's even far outweighs the number of deaths in Africa, for example. And if there's such a surge of infections in the southeast, why are we so relatively slow in tackling that with vaccination?
So I think from a policy perspective, it's probably way above my pay grade to be able to deconstruct why that is. But, you know, I think the UK government, you know, decided to go with the strategy of living with the virus as opposed to a COVID-0 strategy, which many other countries have done. And, you know, so what we're seeing is basically a result of that. You know, so whether that is something to discuss here, you know, on the panel, I think it would probably require a longer and lengthier discussion. But yeah, I will leave it at that.
Yes, and can Dr. Wajid come in on this as well, because I think some of your talk was on that, showing the increasing numbers in the UK compared to everywhere else and the high death rate. Why is that, and why are we so slow in terms of addressing it with vaccination programs?
I hesitate to jump in because Sister Marjan's our expert, but there's a number of things that we need to keep into account. We're literally in the eye of the storm, so we're going to be analyzing this and dissecting this for decades to come. They will be talking about what happened and why it happened. Was it because we have a very elderly population? Was it because the ethnic minorities are inequalities? Because that's what it seems to be, the inequalities in health that were there before that wasn't really that important. You know, yeah, we got a lot more diabetes, but so what, doctor? I got sugar, no problem. You know, I'm just taking blood pressure. Well, now it's a problem. The same thing is happening in America with African Americans. This is when our health disparities have come home to bite. So that's one problem. We're less educated. We're less well off. We have worse control of our diabetes, our blood pressure. We're more likely to be smoking. So to give you an idea, about 50% of all Bengali and Pakistani men in this country smoke. You know, our average life expectancy is not 1 or 2, but 10 plus years less than the average Caucasian person. The health inequalities are mind blowing. And you can just go down any street in West London and you see what stores there are, right? Bookshop, cafe, Starbucks, and so on. Go down any Muslim area, perfect fried chicken, chicken licken, this chicken shop, fried chicken shop you can buy. This was a time bomb that has finally come home to roost for us, unfortunately, here in the UK. Why the vaccine getting out slowly? it's not getting out slowly. It's actually, they're trying to get it out as fast as they've got it. Is the system great? It could be better. It's the most charitable way I could put it. Is the organization that we've been put together, have they made all the right decisions? I think things could be better. But what we're doing right now is we're trying to fix the car while it's running at 100 miles an hour on the motorway. That's what we're trying to do. And it's really hard work. And what will make it easier is if those who are offered it really have good information about whether or not to take it. Because what we're hearing, unfortunately, is that about 50% of the Muslim community is saying that they won't take it, even though they're the most likely to suffer.
Thank you very much, Jazakallah. I hope everybody pays attention, because your talks were particularly emotional about that, and trying to bring out the importance of vaccination, not only just in the Muslim community, but throughout our community. So let's hope everybody's benefited from that, and also your points here about health behavior, changing our health behavior. So Allah gives us lessons for everything. There's two sides to a coin. There might be harm, but on the other side, you have to think, how am I benefiting from this? Am I changing myself and my behavior, my attitude, my approach? All of these things are very important. And as Muslims, we have to grasp that and say, actually, this is a challenge to make us better. How am I going to make myself better? And so with those points, I go on now to Imam Saad Shakib Beg, just to answer a couple of things, just to clarify this issue of whether the vaccination is halal or not. And also there's another question here about, why have we been given this calamity from Allah, and how to seek forgiveness from Allah for our actions, and how to protect ourselves from these calamities. Could you shed some light on that, please, Marsa? I think you need to unmute.
Yes, Jazakumullah khair, Professor Ijaz. I still feel that Dr. Javed is probably more qualified in giving a halal verdict and so on. But very briefly, I think the second point I would start off with, Professor Ijaz, which is, as Dr. Wajid mentioned, I think as a community, as an ummah, a lot of self assessment of ourselves needs to be done. In terms of what we eat, how we eat, our health condition and so on. I think that is very, very important. And, you asked about the wisdom behind this. Everything Allah Ta'ala wills, there's a hikmah, there's a wisdom behind it. That's part of our iman, qada and qadar. That Allah decrees something, there's going to be a khair and a wisdom behind it. And maybe Allah knows best for us as a Muslim community to, assess ourselves and say, look, what are the changes we need to make? Whether it be, the health conditions, whether it be the issue of smoking. I mean, even in terms of, it's kind of like a community that we love eating meat and chicken. Now, the Prophet's diet wasn't that way. Meat and those things were luxuries done at aqiqah, walima, and so on, and when it's Eid and so on. Otherwise, his diet, sallallahu alaihi wasallam, was very different. In fact, he said in one hadith, eat enough to keep your back straight. That was his sunnah. And he said in one hadith, there's nothing worse for a human being than to fill his or her stomach and so on. So a lot of tradition that we learn, that we need to assess ourselves and change the way, our style of living and so on. So that's, I think, one wisdom that comes to mind. The other thing is in terms of, you mentioned concerning halal. Now, I'll just mention principles. Number one, we have this principle, they call it maqasid al-sharia. Maqasid can be translated as objectives. And one of those objectives is hifdhul nafs, protection of the self. So we are supposed to be that community. I would say to our, my local community, Muslims are supposed to be leaders in situations, especially situations like this, guiding to people to that which is noble and pleasing to Allah Almighty, to God Almighty. So hifdhul nafs, protection of the self, that's an objective of our religion. And Allah Ta'ala, that's where we find the verse that we always mention, Man qatala nafsan bighayri nafsin aw fasad fil ard كأنما قتل الناس جميعا ومن أحياها فكأنما أحيا الناس جميعا. The one who kills one soul, it's like he or she has killed all of humanity. And the one who saves one soul, then it's like he or she has saved all of humanity. So حفظ النفس, an important part of our faith, our tradition, which leads us to the next point, which is more, specific to your query and question in terms of what we have, al-ahkam al-taklifiyya, the 5 rules and regulations. Everything in the Muslim's life is going to fall into these things. Fard and wajib, obligatory. Yeah, mustahab, recommended. Mubah, permissible. Haram, impermissible. And of course you have the makruh, disliked. Now those ahkam al-taklifiyya, when we are discussing the vaccination, what would that vaccination fall under? I would say, and Allah Ta'ala knows best, but I would say either it falls into the ibaha, the mubah being permissible for some, either it falls into mustahab, recommended for some, either it falls onto obligatory for some. It is within those 3, permissible, recommended, and for some it will be an obligation. And again, that would again need, specialists and people referring back to doctors say, for you, you must have it. For you, it's highly recommended. For you, it's okay. But those are the general, I would say, principles in terms of concerning the vaccination.
Jazakallah. So I think, are there any other questions, Umar, that you've noticed which we haven't gone through? There's quite a few. I've tried to bunch them together in asking.
Dr. Javeed has a question.
Yeah.
Sorry, it's not a question. Professor Ijaz, your question came back to me. I think you had asked me a question about, someone asked about should the vaccine recipients, should they still practice face mask, social distancing? I think, sorry, it went out of subhanallah. The recommendation as of now is, because the vaccines, when they were studied for endpoint efficacies where we're preventing COVID-19. They were not looking to see, well, this patient or vaccine recipient is still shedding the virus or not. So that was not studied. So therefore, the recommendation still is that even vaccine recipients, whether you have got 1 dose or 2 doses, we still need to practice hand washing, wearing the face mask. Those standard things still apply. And there is some evidence which has given, particularly from the Moderna vaccine trail, and it does seem to suggest that from that evidence there might be a promising thing that people with who received the vaccine may not transmit the virus, but that's still an early evidence, and hopefully we hope that's going to be the case, but we do not know. So my advice would be to continue the social distancing and face mask and hand wash. So those rules apply. Thank you.
Thank you. So while we've got you here, Dr. Jawed, one more question on the, do we know how long the vaccination will give you protection for? And another question leading on from that was, do you anticipate annual vaccinations for COVID?
Mashallah, they are very, very good questions. We have to appreciate the lack of evidence here again. We think, and there is one excellent paper which has just been published from Seattle, which is still in preprint, from other coronaviruses. What we know is that it's quite optimistic that the vaccine antibodies and even the natural infection antibodies actually they persist for longer than what we had expected. Sometime last year, we were thinking 3 to 4 months, 6 months, but apparently the T-cell immunity, which is a memory immunity, seems to last for many years. Now, in the background of this, we have to be worried about what we call as the variants, which you might be hearing from the news. As of now, we know the British variant, I shouldn't use the word British, B117 variant and the variant from South Africa, both there is an evidence that vaccine respond to those variants. There is just in the last 48 hours, we have the South American, the Brazilian one and the Japanese one. They have a particular mutation which is affecting the spike. So we do not know as of yet whether the vaccine is going to be efficacious or not, but the assumption is that these are minor variations. The vaccine has been designed to cover the entire spike protein which is more than 20 amino acids. So these are variations, probably a few variations, in the amino acids. So the hope is that the vaccine will still be efficacious against the variants. But moving further, whether do we need to have 1 year? What happens is, the viruses are going to, because of the vaccine, there will be a vaccine pressure as well. So there will be a pressure on the virus to change. So maybe end of the year or next year, only Allah knows best here, when the virus may completely change the spike protein. And at that point, the current vaccine has its time may not be efficacious. But however, again, there is all hope here. We already have the backbone. Until 2 months ago, we didn't have the backbone. The backbone is we already have the mRNA vaccine backbone. All we need to do is to get, if there is a variation which arises, variant which arises, then we just have to modify the mRNA. And we don't have to redo these massive trials to prove to the public that these are highly efficacious again. So it will just be a tweak. And if you ask the experts, the experts are saying possibly maybe 1 in 2 years, we may need to have the vaccine. And the wider hope is that probably in a few years' time, this will become like a common cold virus. We may not at that point, we may not need to have the yearly or the once in 2 yearly vaccination. But it's too early to say anything of this. What I can understand is probably it will happen that road where we give once in a year or once in 2 years. Thank you.
Thank you, Jazakallah Khair. Thank you very much for your comments and answers to those wide and varied questions. I think we have to call it a day now. Thank you for all the panelists. I think it's been an excellent discussion today. And thank you for the viewers. I must apologize if we haven't answered all the questions. We did our best to answer as many of the common questions that we were getting sent through. So thanks again for the panelists for your contribution. It was really, really effective, I think. I think for somebody, I'm medical as well, but I've learned so much tonight, which is so useful. And particularly what came across was how severe this problem is, how severe this disease is, to take it seriously and to protect yourselves, but also to do your civic duty and to protect others, your family, your friends, people at work, protect everybody, because we're nowhere near finished with this. This is very, very serious at the moment. So thank you very much, everybody. I think, Umar, do you want to just finish off the evening?
Thank you. No, Jazakallah khair. Really, really appreciate that. Actually, what I'm going to ask to do, panelists, if you wouldn't mind, in 1 minute or less, summarize your thoughts, your final words, really, to the audience. In particular, Dr. Javid, there were a couple of questions that, if you could include it in your response, essentially it's looking at reassurance over the long-term risks, but also why have we chosen vaccines as opposed to other potential management options? Ivermectin was mentioned, chloroquine was mentioned. So why vaccines in particular, and some reassurance over the long-term side effects? So within 1 minute, as I say, if you could each please give your final words. We'll start with Dr. Javid.
Yeah, thank you, Dr. Omar. I wish I could have had more. I could have highlighted an example of Rwanda, which is the 117th ranking on the GDP when compared to how Rwanda has performed to United States and European countries. They have done exceedingly well. The reason why they are doing exceedingly well, to answer to that, why vaccine, why not medication, is simply one statement: prevention is better than cure. The vaccines, timeless. If there is one thing which has happened, benefits to humanity in the last 150 years. I mean, even if it's smallpox, measles, mumps, rubella. I mean, we don't have antiviral therapies to measles, mumps, rubella. These are all, and ivermectin, these are all experimental, and we don't even know how efficacious these will be in ITU patients. We are talking about preventing individuals landing up in the hospital, landing up with the severe COVID-19. And I don't think, it boils down to common sense then, whether we want to choose to get ill potentially and land severely in an ITU environment, and then have ivermectin, which may or may not work, or rather be 90 to 95% sure that you get the vaccine. Definitely, there is a good antibody response, and which can give you 90 to 95% protection. And also, we contribute wider to the community by saying that we are part of that herd community. We are like a global human chain. By taking the vaccine, we are actually preventing deaths. And only Allah knows how many deaths we would prevent by getting the vaccine. I mean, of course, no one knows the long-term efficacy of this, long-term side effects of this vaccine. But what we know is that these are highly efficacious, safe, and not very localized adverse effects. And I just want to give a key message here, because there will be a lot of bad press with the vaccines in the next few weeks. Because every day some people die naturally, and it may happen now nearly when we hit the 4 million, 5 million of the population get vaccinated. They may die of natural deaths. Some of them may die of natural deaths, and these I want the wider public on this audience to remind them to be aware of the popular media who create hot news saying that the vaccine recipient died. Until the news comes out, wait, how did that, if at all, if there is a vaccine death, wait to see what actually happened. It might be a natural death happening in those 5 million individuals. The bottom line is, when I hear from Dr. Wajid that 50% of our community is declining vaccination, that's not like a crack in the dam. That's a big hole in the dam. Even without a surge, that dam is going to break. So I personally, from my point of view, get a vaccine. My recommendation is to get a vaccine when your time comes. Thank you.
Thank you. Ustadha Marjan, if you could give your final comments, please.
Yeah, so I think this forum is great, and from a policy perspective, I'm sure most of you will know, our representation is very, very important, and especially coming from like a Muslim perspective, but also much wider from the Bain community, it's really important that we are having discussions. So I think my main message would be to let's keep talking about COVID, let's keep talking about the vaccines, let's just keep talking. Let's not let absence of communication take part between ourselves and between the wider community, inshallah.
Dr. Wajid.
Assalamu alaikum, jazakallah khairan. My message to brothers and sisters, when you're looking at the vaccine, and many of you asking questions, when you're looking at the vaccine, look at it in a balanced way. What's a balanced way? That means look at the side effects, look at the issues that you have, look at the worries, look at the concerns, look at all those things. But if you look at them alone, as if we were not living in a pandemic, as if we didn't have 1,500 people dying a day, as if we didn't have orphans and widows being made every single day, as if we didn't have struggles to bury our dead, as if we didn't have a duty for our community, as if long COVID doesn't exist, as if it doesn't take like years off people's lives, as if the economy is not going to collapse, as if it's not going to affect people's mental health, then you're looking at it in an unbalanced way. A balance would be to look at these two things. That is balanced. So when people come to you, and our Prophet Wallahi al-Azim, throughout this pandemic, every time I look for a hadith, you find it is, truly he was a Prophet The Prophet said words to the effect that there will become days of treachery when the liars will be believed and the trustworthy will be called liars. Don't fall into those days. That when someone comes to you, and exactly as Dr. Jaweed said, they will tell you that they died because of the vaccine. If 3 million people go on Hajj every year, when you have 3 million people, some of them will die because that was their time to die, not because of Hajj. So Hajj is not killing people. Similarly, some people, if they die, now I'm not saying that the vaccine is going to be 100% safe, it's 100% everything. No one is saying that. But what we're saying is, when you look at something, please look at it in a balanced way. On one side, your concerns, your worries, your issues, and speak to people like Dr. Jaweed, like microbiologists, like consultants, like your local healthcare professionals, and ask them. But on the other side, weigh up the theoretical harm, against the real devastation that's being caused right now. Because if we don't act, and you heard there's a new variant already from Brazil. If you don't act, if we don't get on top of this, there will come a time in which what we're in right now will look like a playground compared to where we could be. Don't end up like that. Let's save ourselves, our own lives. Let's save our families, our communities, and the world, inshallah. That's what Muslims are put on this place, on this earth, to be Khalifa on earth, to protect humanity, to protect ourselves, and to put Allah subhanahu wa ta'ala's name above all others. And let's implement the best aspects of our deen, look at it in a balanced way, and then make the decision, inshallah.
Wafiq, thank you for that. And finally, Imam Shakir, your final words.
Rahim. Firstly, special thanks to Dr. Umar Taha, Professor Ijaz, for facilitating this through SELKCOM, South East London Kent and Council of Mosques. May Allah Ta'ala reward you all with khair and increase you in khair. And a special thanks to our specialists today, Dr. Javed, Dr. Wajid, Ustadha Marjan, for their valuable talks. I'm sure, from the comments that we received from the viewers, it's been very, very beneficial. May Allah Ta'ala, reward you all with khair, increase you in khair, and inshallah place this, this talk of yours in your mizan of hasanat. And lastly, I ask Allah Ta'ala to relieve the world of this pandemic that we're all facing. I ask Allah Ta'ala to give shifa to anyone that has fallen ill through this illness, and ask Allah Ta'ala to forgive anyone that's passed away, their shortcomings, their sins, to grant them Jannah, to grant them Rahmah, to grant them Maghfirah. Jazakum Allah khair. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair, Sheikh. And just finally to say a big thank you to everyone for listening. Huge thank you to my co-host, Professor Ijaz, and especially for all of the panelists, the whole team behind this session. This couldn't have happened without you. And for those listening, if there are burning questions that you had, as Dr. Wajid said, Bima, please feel free to get in touch with them, or your local health professional. Get in contact with your GP, with the local doctor, and please do feel free to ask them. Thank you all so much. Wa assalamu alaikum wa rahmatullahi wa barakatuh.